Who's crazy here anyway?
In psychology, distinguishing between who is normal and who behaves abnormal is fundamental. Mental health professionals use one or more of these criteria to determine a person's behavior. But can mental health professionals truly be able to give a correct diagnosis? And what is the consequence of making a mistake? David L. Rosenhan's study, Who's Crazy Here Anyway?, answered these questions. Rosenhan questioned if the characteristics that lead to psychological diagnosis reside in the patient themselves or the situations in which the observers find the patients. Rosenhan proposed that a way to test a mental health professional's ability to categorize prospective patients correctly would be for healthy people to seek admittance to psychiatric facilities. He hypothesized that if these pseudo-patients acted normal in the hospital after being admitted, and mental health professionals fail to recognize that they are healthy, this would be evidence that diagnosis of mental illness is more determined by the situation rather than by the patient.
Methods and procedures. Rosenhan recruited 8 participants, including himself, to serve as pseudo-patients. The mission was to admit themselves to 12 psych hospitals in 5 different states, spanning from the East Coast to the West Coast. All pseudo-patients followed the same instructions. First, they called the psych ward and made an appointment. When they arrived, they all complained that they were hearing voices saying things like empty, hollow, and thud. Other than this initial symptom, all pseudo-patients were required to act completely normal and give truthful information to the interviewer. After the intake interview, all 8 participants were admitted to the psych ward and had no idea when they would be allowed to leave. It was entirely up to them to gain their release by convincing the hospital staff that they were mentally stable enough to be discharged. The participants' main goal was to be released as soon as possible, so they behaved as model patients, even going to the extent of cooperating with the staff and accepting all medications, which they flushed down the toilet instead of swallowing. In addition to this, all pseudo-patients took notes of their experiences, and at first tried to conceal this activity, but soon realized that secrecy was unnecessary because the staff just interpreted their note-taking behavior as another symptom of their illness.
The results of this test showed that Rosenhan was correct in his hypothesis. The health professionals cannot tell between a normal person acting crazy and people that actually had schizophrenic symptoms. These health professionals do not have a good procedure in order to tell between who is normal and schizophrenic, thus begging the question, who's crazy here anyway?
So, what makes Rosenhan's study one of the greats that changed psychology? Why is it significant? Well, Rosenhan's study did 2 things. First, it made it obvious that in mental hospital settings, the sane could not be distinguished from the insane. Since the definition of what behaviors categorize patients were not very clear, they were easily misunderstood. That type of environment for the people who are supposed to be getting help is undoubtedly counter-therapeutic, as Rosenhan puts it. Second, the study established how dangerous diagnosis labels in these situations can be. As soon as a person has been labeled with a diagnosis like schizophrenia or depression, all their other characteristics get overlooked and seem to disappear into the shadow of their diagnosis. These other parts of them instead seem to become a part of the diagnosis and appear as results of it. The saddest part about these types of treatments is it can become self-confirming to the patient, that if a person is treated like they have something, they will themselves start to believe it is undoubtedly true. Overall, Rosenhan's study paved the way for mental health professionals to be more aware when giving out diagnostic labels and the dangers that go along with them. The problem that this study addressed has declined due to patients not being confined to mental hospitals as much. Antipsychotic medications have come out that can help reduce symptoms so people can live by themselves and live relatively normal lives. Simultaneously, there was a growth in community mental health facilities, crisis intervention centers, and behavior therapies that focus on specific problems and behaviors which contribute to the avoidance of diagnostic labels altogether. Labels haven't disappeared altogether, but they are now being used carefully and the people receiving them are now being treated with respect.
In conclusion, we should dig deeper into the mental health of people before we start to label the problem. Same goes with disorders. One thing we should refrain from doing is creating a problem before we can even tell what the problem is. With labels, that can happen. Let's say you label someone diabetic, they are more likely to start acting like a diabetic. To relate it with mental health, let's say you tell someone they have schizophrenia. they are more likely to start acting like they are hearing things. The thing is that we do need labels to better understand what is going on and are a very effective way of getting treatment for whatever the disease. The labels will never go away, so with that in mind, we should learn to accept and change. Accept the label and change the way you view the label.